Hello and welcome to the second video by the Public Health 5 to 19 nursing team. This video is going to focus on probably the most important part of our daily routine, and that's sleep. We know from our local public health data that many primary age children in Cumbria are not getting enough sleep, as over 50% reported sleeping for less than 10 hours every night. Children aged 6 to 11 years need between 10 and 12 hours sleep, which means that in an ideal world, and importantly on weeknights, your child should be tucked up asleep in bed by 9 o'clock. We appreciate that every child is different, so if you are experiencing sleep problems with your child, you should discuss this with your GP or perhaps make an appointment with one of the nurses on our team. Our lives have been turned upside down with COVID-19, so you may be finding that your child is struggling to settle to sleep, but a regular bedtime routine will help this. Here are some things we recommend. Here's Donna with 7 tips.
Hi everybody, my name's Donna and I'm going to go through the 7 tips with you today. So tip number 1, if possible, try and have your evening family meal by 6 o'clock. This is because some children need a good couple of hours for winding down before bedtime. Tip number 2, turn off all digital screens. It's okay to have the telly on before bed. If they're watching something they've watched again and again, then that can actually be quite calming. But no digital screens 2 hours before bedtime. Tip number 3, bedrooms should be screen free. So remove all digital appliances and televisions before your children go to bed. Tip number 4, a warm bath or a shower actually reduces our body temperature and gets it in the perfect temperature for sleep, as well as helping us relax. Tip number 5, if your child has an early evening meal, then give them some supper before bedtime. A plain biscuit, a slice of toast, a small bowl of cereal and maybe a drink will help them settle. Tip number 6, now it's time for bed. So a nice chat or a story really helps give that time to connect with your child before they settle down to sleep. It might be that older children will read, some children will do some drawing or play with their cuddly toys on their bed. All that is fine. Some children sing or natter to themselves, and it's just their way of finding something that helps them relax and settle off to sleep. Tip number 7, some children might need a little reminder of a quick trip to the toilet before they settle down to bed, particularly if dry nights is a problem in your house.
Thanks so much for listening to our video today, and we really hope it has been some help to you. If you would like to speak to one of our nurses, you can make an appointment at our eSchool Nurse video clinics. These take place every Tuesday and every Thursday. To make an appointment, telephone 0300 30 34 365 and ask to book an appointment at the eSchool Nurse video clinic. Thanks very much and take care. Bye bye.